There's been further attention today on care homes in the UK and whether the government is adequately supporting them. Ros Atkins has been looking into this for us.
Unfortunately, more than 11,000 people have died in UK care homes during this pandemic, and the government continues to face questions about whether its decisions exacerbated the situation. First of all, let's hear from the head of the organisation which represents the industry in England, who's been giving evidence at a parliamentary committee today.
Despite what has been said, there were cases, I think, of people who either didn't have a COVID-19 status or were symptomatic who were discharged into care homes. Now, given that the care homes are full of people with underlying health conditions, I think we should have looked at focusing on where the people at most risk were, rather than thinking about particular organisations.
While the former Prime Minister Gordon Brown has had some fierce criticism for the government, he's contributed to a new think tank report on this issue, and he's been speaking to the BBC.
Well, I've come to this not because I want to involve myself in the political arguments, but because I've seen two friends die. I've seen people who are workers at care homes risking their lives to save homes. And I've seen the figures which show that half the deaths in Scotland, where we've done this report, are in care homes. And it's tragic that even today, not all care home residents and not all care home workers have been tested.
While the government, for its part, says most care homes, more than 60% it says, remain free from COVID-19, the Health Secretary Matt Hancock has also said the industry is being given unprecedented support.
From the start, we've worked hard to protect those in social care. In early March, we put £3.2 billion into social care, half through the NHS and half through local authorities. And we've repeatedly set out and strengthened guidance for infection control and support.
Well, once the UK has passed this first wave of COVID-19, there will, of course, be plenty of lessons to be learned. Here's BBC's Vicky Young in Westminster.
This is, of course, about what went wrong and who might be to blame, but it is as well about learning lessons and making sure it doesn't happen again, particularly, I think, with what's happened in care homes. Now, listening to some of those who work in the sector, you could really hear their anger and frustration. They've said for a long time that they think that the health service and the care sector, they do need to be much more integrated. Now, we've heard that from various governments for years and years and years, and it simply hasn't happened. And I think this epidemic really has exposed some of the flaws in the system.
Now, there are three things to bear in mind here. March was the month when the virus started to spread rapidly in the UK. We heard Matt Hancock refer to it just then. And we know that in March, the government abandoned efforts to test, track and trace because of a lack of testing capacity. It also chose to lock down later than its European neighbours, despite the threat of the virus being known. And, as the head of Care England said just now, it allowed patients to be discharged from hospitals to care homes without a test. And all three of those decisions are believed to have impacted on the UK's ability to contain the virus, though the government has defended its actions throughout. We had better news today that the number of new deaths in care homes has fallen for a second week in a row in the UK. And while the political row continues here, we should say that this is an issue affecting a great number of countries. The World Health Organization, in fact, has called the impact of COVID-19 on care homes an unimaginable human tragedy, and it estimates that half of Europe's fatalities have been in care homes, which in part is directly connected to the fact that the virus is a far greater threat to people over the age of 70. But it's not necessarily that simple. British MPs today heard evidence from Hong Kong because despite being close to the source of the outbreak in mainland China, it's had 0 deaths in care homes.
We do a very good job in isolation. So once we have any person infected, we isolate that person in hospital for treatment. But at the same time, we isolate all the close contact people into separate isolation center, quarantine center for 14 days for observation. And they did a test regularly within that 14 days to make sure they don't have the virus.
Well, questions are already being asked as to whether strategies like this should have been used in countries which have seen far higher death tolls in care homes. One of those countries is Canada. This article from the Washington Post highlights that 81% of its 6,000 coronavirus fatalities have been in long-term care facilities. And perhaps this statistic demonstrates how some governments misread the threat of the virus. While they understandably focused on the capacity of their hospitals, less attention perhaps was paid to the vulnerability of care homes and the people living in them. This is Canada's Prime Minister last month.
If you're angry, frustrated, scared, you're right to feel this way. We can do better. We need to do better. Because we are failing our parents, our grandparents, our elders, the greatest generation who built this country.
Well, let's just hear from Georgie Smith, a CBC reporter in Vancouver.
The country's first outbreak and death occurred here in BC at a care home in North Vancouver in March. But by far the hardest hit parts of the country are in the east. Provinces like Ontario and Quebec last month requested the assistance of the Canadian military in an effort to contain the virus in seniors and long-term care homes. More than 1,600 soldiers were deployed, and in a sign of just how difficult it is to contain this virus, a dozen of the soldiers that were sent are now infected. Federal guidelines were put in place to restrict access to these care homes, and staff were prevented from working between facilities. There are calls for a public inquiry into the management of this crisis, and a general acknowledgement that Canada's network of long-term care homes was left exposed by critical staff shortages, a lack of investment, and cramped living conditions.
Well, for more on the care home situation in the UK, I'd strongly recommend this excellent article by the BBC's health correspondent Nick Triggle, which was posted today. In it, Nick notes there are already calls for a public inquiry into this part of the story, and that inquiry would appear to be an inevitability at some point in the future.
Roz Atkins there.